Hey everyone, talking a little bit more about recovering after surgery for bunions, hallux valgus, or also known as hallux abductor valgus. Depending on the procedure, it's really important to get a good gauge of when you should be expecting to be walking, how you'll be walking, when you'll be getting back to your activities and your sports. All of these questions will very much depend on the procedure, but typically you will be weight bearing in that immediate post-operative course. For those that are doing a fusion procedure or something to the proximal metatarsal at the base, that's where I typically have my patients on crutches for 2 weeks, and then we try to get you back into your normal walking as soon as possible. Everyone will be in a post-op shoe for a few weeks, and that could be 4 to 8 weeks. Working wise, depending on your pain levels and what you're doing for work, as long as you're not needing to get to the printer too often, I'm usually happy about 2 weeks for people to go back to seated work. But it's really important in that first 2 weeks, and particularly further on for that next few weeks, keeping the foot elevated so we can reduce any swelling or edema that occurs. Depending on the job, again, standing from 6 to 8 weeks going back is okay. Typically I find that my teachers and my labourers may take that longer duration, and again it will depend on your procedure and how heavy impact your activities are. And so really get a good idea of what's going to be appropriate depending on the procedure required, and that's going to depend on the level of deformity or bunion deformity there. As I mentioned, back into those joggers by 4 to 6 weeks. I'm really proactive on this because it's about getting back into normal activity. Sometimes the shoe size may go up a half size to a full size, depending on that swelling in that first 6 months potentially. And so really having a good idea and understanding of, okay, this may be required for our patients is important. I'd like to get people back to walking for leisure as soon as they tolerate, and that could be, depending on the procedure, 6 to 8 weeks. But for some of those fusion procedures where we're wanting to really make sure that that bone's healing, it could take up to the full 12 weeks. And similarly there, for getting back into sports, will be very much pain related, as well as what we're seeing on the x-rays as far as healing. But typically we're getting people back into sports between that 8 to 12 weeks, very rarely a bit longer than that. So hopefully this has given you a bit of information about recovering after bunion surgery. Do subscribe, have a look at some of our other videos that we've got available as well. Leave a comment if you'd like, but otherwise we'll see you in the next content video. Cheers.